Hello dear doctors, nurses, medical students and healthcare team. How are you today? I hope you are well. Here we are going to talk about another question of cardiology. A 71-year-old man recently feels breathless on exertion, accompanied by palpitations when resting. He finds them difficult to describe. An ECG was performed, which is attached below. What is the single most likely diagnosis? We can see in the patient's ECG, it's irregular with a rugged baseline pattern, and here we are going to see the choices. A. Atrial fibrillation. B. Ventricular fibrillation. C. Ventricular tachycardia. D. Supraventricular tachycardia. E. Wolff-Parkinson-White syndrome. As we can see, we have an irregular rhythm with a rugged baseline pattern or fine baseline pattern, which is pathognomic for atrial fibrillation, and according to the signs and symptoms also it is atrial fibrillation. Here we are going to talk a little more about this pattern. The diagnosis here is atrial fibrillation, a completely irregular rhythm. When looking at an ECG, we should use a stepwise approach. First step, we must calculate rate. As we can see, the rate of atria is slowly increased. It's more than 300 per minute. Okay. Step 2, determine irregularity. Is the ECG irregular or regular? As we can see here, it's completely irregular rhythm. Step 3, assess the P waves. Do we have any P waves? Can we see any normal P waves? And as we see, we don't have any normal P waves. These may be P waves, but we cannot say which one of these are P waves because of a rugged baseline pattern. Okay. Step 4, determine PR intervals. Is the PR interval constant or it's not constant? And as we can see in this ECG, we have completely irregular rhythm, and there is no any consistency between or intervals. Here or interval is decreased, here is increased, and here is increased more, and the pattern is going like this. Okay, determine QRS duration. How much is the QRS duration? As we can see here, the QRS duration, we can count the QRS duration, and it's increased or decreased. We can evaluate it. Okay. Determine the axis. Is the axis in a normal range, or it's increased, or it's in positive pole, or it is in negative pole? We must determine the axis. Look at the morphology. We must first thing we can do, we can look carefully at the total morphology of ECG, and if there is any clear abnormality, we can diagnose that easily. Okay, as we can see in this ECG, it's showing atrial fibrillation. Also, we have completely irregular rhythm with a rugged base. We cannot see any normal P waves, and this is pathognomic for atrial fibrillation. In this ECG, at step 2, determine regularity. We can already see irregularity here just by looking at the or intervals. As we said, there is no any consistency between or intervals. The initial thoughts in management when seeing an ECG like this is, first, is the patient stable or not? Is there rates control? And third, what is the patient's CH2 DS2 VASC score? Okay, it's the CHA2 DS2VAS score is important for evaluating the patient's risk factors for admitting thrombolysis or not, especially in patients with atrial fibrillation, because they are at risk of thromboembolism. In other YouTube videos, we explain about the patient's score, whether they can receive thrombolysis. We talked about it in our YouTube videos. For more information, you can watch them. Here was a short explanation about the patient coming with atrial fibrillation. Thank you for your attention.